Thailand plans to progressively open up the country for international tourism by using the Phuket Sandbox program as a stepping stone. From the 15th of July, the kingdom will expand its island reopening program to Koh Samui, a tropical island beach holiday destination in the Gulf of Thailand. Vaccinated visitors from many countries or territories will be able to spend a holiday in Koh Samui. Koh Tao and Koh Phangan, two world-famous islands north of Samui, will also reopen as a part of the Samui reopening. This project is called Samui Plus Model. Travelers must travel from countries or territories approved by the Center for COVID-19 Situation Administration and must have been in the said countries for no less than 21 days before their travel date. International visitors must be fully vaccinated at least 14 days before their departure with vaccines registered with Thailand's Ministry of Public Health or approved by the World Health Organization. A vaccine certificate must be presented as proof. A negative RT-PCR test result issued no more than 72 hours before departure must also be presented. Visitors must also purchase insurance for COVID-19 medical expenses with a minimum coverage of $100,000. Children under the age of 18 are not required to be vaccinated if they travel with fully vaccinated parents or guardians. However, they must have tested negative for COVID-19 no more than 72 hours before their departure. International arrivals must transit through Bangkok Suvarnabhumi Airport before connecting to a dedicated flight to Koh Samui. Visitors must download and activate the alert application specified for Koh Samui upon arrival. To allow a balance between the holiday mood and healthy travel, the rules and regulations have been redefined for entering Koh Samui. Hotel reservations in Koh Samui must be made prior to arrival. Foreign visitors will be required to stay at Samui Extra Plus hotels for the first 7 days, with the first 3 days confined to their hotel or resort. They can, however, leave their rooms and use some hotel facilities as well as access to designated areas. From days 4 to 7, they can travel on a sealed route to see popular tourist attractions. During the second week, visitors can travel to Koh Tao and Koh Phangan. There are COVID-19 DMHTTA precautions, which are distancing, mask wearing, hand washing, temperature testing, COVID-19 testing and alert mobile app installation. All said precautions should be followed while on holiday on the islands. Visitors are also advised to keep an eye out for SHA certification while visiting restaurants, wellness centers, and golf courses to maintain safe travel. The SHA logo speaks for their service standards that have been certified for quality. More than 300 hotels, restaurants, and other service providers on Koh Samui, Koh Tao, and Koh Phangan have been certified for SHA and SHA Plus certification. Renting a private vehicle to travel around the islands is not permitted. Visitors can only use transportation and travel agencies that have been approved by the Disease Control and Prevention Center. Visitors will be required to take 3 RT-PCR tests. The first on the first day, the second on the 6th or 7th days, and the last on the 12th or 13th days at their own expense. Upon completing the 14-night stay, visitors will receive a letter of confirmation from the hotel. With a COVID-19 negative test result, visitors can now travel to other destinations in Thailand. Those with less than 14 days of vacation will have to leave Koh Samui on a direct international flight, or through a dedicated flight by Bangkok Airways to connect to a direct international flight at Suvarnabhumi Airport. For more details or any updates about the Samui Plus model, please visit worldwideweb.tatnews.org.